I feel like I'm in a constant state of bewilderment and horror at how bad things have become. And I don't want to lose this sense of bewilderment and horror, because the whole concept of austerity is plain and simply wrong. The crash was not caused by children, people on a low income, the chronically sick, the disabled and the unemployed, yet they're the ones being punished. It should not be business as usual in the voluntary sector as we see the people we represent suffer. And it shouldn't be business as usual in advice centres as we try to meet the demand from the hordes of people who need advice due to welfare reform, every one of them an individual in desperate need of our assistance, struggling to have enough money to put food on their table and keep a roof over their heads. View Digital is a great resource for all of us who work in social affairs to get the stories that need to be heard out there.
I especially would like to thank the people who, I suppose, told their stories, because it's not often easy to do that, and it takes a certain amount of bravery to be able to, tell people about what's happened to you and the personal impact it's having on your life, etc. So well done to all of those people. We in Advice NI obviously are very aware of all of the impacts of welfare reform, and we're very concerned about the future. We're sitting at the moment in a place where we have no government. We have a mitigations package which is about to come to an end in 2020.
This is grim and it's going to get worse. It just is. So we captured a snapshot of it, from people that we talked to, people that we spoke to. I mean, there's people on disability living allowance for years who are getting what they're entitled to get because they have these disabilities, and they've got medical notes to back it up. They go into a PIPS assessment and they're given 0 points. I mean, just think about that. You've been told you have medical evidence to show that you have these conditions. You do this assessment which lasts 30 minutes or so, and then you're told you have no points, which effectively tells you that other assessment was wrong. You're actually capable to work. I met one mother who has a son living in her house, and he's 45, a load of complex mental health issues. Changed the name and details in the stories because they wanted that, but they want their story to be told. And he's living with the parents, and the father's got terminal cancer. Mother brought him to the assessment. A 45-year-old man went to assessment with his mother, and at the end of it, the assessment report said that he made good eye contact. He looked at the woman once, and the rest of the time he stared in the ground, and his mother answered all the questions. So the father showed me a letter that he wrote. He said, I don't expect anybody in the department to change their view because of this. We thought he had to write something. Very eloquent man, worked for many years in civil service, paid all his taxes, done everything he should have done. Very decent, honourable, law-abiding citizen. And he showed me a letter he wrote, and in the letter he says, if all these things about assessment were true, I would be the happiest parent alive. But it's just not true. I have the evidence here. My 45-year-old son is living with us, and it's a really difficult issue. Now the department or Capita or even the institutions they're not interested in that. It's a results-based programme.